In these two updated videos, I'll be reviewing the epidemiology of COVID-19 as of January 6, 2023. All data to date continues to support infection spread by respiratory secretions. Close contacts can inhale droplets or aerosol associated with coughing and sneezing, as well as when talking and even when breathing. Droplets can also land on surfaces where they can survive for hours to days. Infected surface particles are often called fomites, and for SARS-CoV-2, fomites have proved to be a rare route of spread, and absolute proof of fomite spread has not been published. Droplets usually do not project beyond 2 meters or 6 feet when someone speaks or coughs. However, a powerful sneeze can project droplets longer distances. The size of droplets varies, and when talking, coughing, and sneezing, we produce a population of smaller particles, under 5 microns in size, called aerosols, and these fine particles can stay in the air for up to 3 hours. In the case of the Delta and Omicron variant, where virion concentration can be very high, aerosols are likely to be the predominant mode of spreading of the infection. Singing and certain procedures such as intubation are known to generate larger amounts of aerosol. This mode of spread is also likely to explain outbreaks in closed public places, including bars, restaurants, churches, and indoor malls. We now know that asymptomatic or pre-symptomatic infections make up a very significant percentage of cases. Recent studies now estimate that 40 to 60% of those infected are pre-symptomatic or asymptomatic. And with the arrival of Omicron, many of those who have been received 2 vaccination shots or a single J&J vaccine are experiencing breakthrough infections. Many of these breakthrough infections are asymptomatic. Children and adolescents are more likely to have minimal symptoms. There are multiple reports of super spreaders. One of the most notorious examples remains case 31 from South Korea. This 35-year-old Chinese woman traveled from Wuhan, China to Daegu, South Korea, where she visited a megachurch twice, as well as a hospital, and while febrile ate at a buffet before she was diagnosed. Tracing determined that she had come in contact and infected over 1,160 people. It is likely these super spreaders generate more aerosol. The virus can also be found in stool, but is difficult to culture, and no cases of transmission by this route have been reported. To date, perinatal transmission is rare, but has been reported. Contact tracing studies revealed that someone infected with the original virus can infect 2 to 2.7 others. This number is termed the R sub naught, or reproductive number, and this virus is one of the most highly infectious agents ever reported. The more infectious alpha and beta variants have reproductive rates of 3 to 5. The Delta mutant, 5 to 8, and the Omicron, a reproductive rate of 10 to 16, comparable to measles. Over the past year, Omicron variants have been the dominant subspecies throughout the world. As described in the video on pathogenesis, new mutants derived from the original Omicron variants BA1 and BA2 are better able to escape vaccine-induced immunity, as well as the immunity induced by infection. Currently, 2 subvariants are becoming dominant in many parts of the world: BQ1.1, derived from BA2, and XBB1.5, derived from BA5. There is great concern that the new surge in China will produce additional variants that could prove to be even more contagious. The efficiency of spread varies depending on the degree of crowding. For example, in New York City, the original wild-type virus reproductive rate rose from 2 to 5 because of crowding conditions. And New York City is now experiencing a surge of Omicron variant cases. In-depth analysis now reveals that individuals who are infected vary with regards to their ability to spread infection. The 80-20 rule applies. That is, 20% of those infected account for 80% of the infections. Therefore, each super spreader, on average, would be expected to infect anywhere from 10 to 80 individuals. Why 10 to 20% of infected individuals become super spreaders while 80% fail to spread the infection is not known. However, super spreaders are thought to have higher concentration of virus in their secretions, up to billions, 10 to the 9th, or even trillions, 10 to the 12th, of viral particles per ml. Strategies to control the spread of infection should focus on identifying these super spreaders and quickly isolating them. But more about this issue in the Rise video on prevention in Module 3. The surge of cases last winter and this winter throughout the U.S. and Europe emphasizes the role of weather. Aerosol most effectively spreads when the weather is dry and cool and when people congregate in small, poorly ventilated spaces. The majority of cases are contracted through household contact. Original estimates were that 10% of household contacts contract the disease. However, a CDC prospective study in Tennessee revealed a 59% rate of infection in households. 75% of these infections developed within 5 days of identifying the first infected family member. This was in the case of the Alpha variant. It is likely disease spreads even more quickly with Delta and Omicron. With the spread of the Delta variant, it is highly likely infection rates within families will reach 90%, and with the Omicron, close to 100% unless cases are very quickly recognized and isolated. 80 to 85% of infections are contracted within the family, called family clusters. Other settings have included the megachurch in South Korea with 1,200 cases, cruise ships, bars and restaurants, and gyms, other large outdoor gatherings, American football stadiums like the University of Florida Swamp, and European football stadiums were initially a concern. It has become clear that SARS-CoV-2 is predominantly spread indoors. It is an indoor virus. As countries have opened bars, coffee shops, restaurants, and gyms, outbreaks of disease have been observed. As this figure in the CDC MMWR Morbidity and Mortality Weekly Report revealed, those who ate at restaurants had a 2.8 times higher risk of contracting the virus and a 3.9 times higher risk if they went to a bar or coffee shop. This data was accumulated before Delta or Omicron variants became the dominant infecting strains. Therefore, conditions are now likely to be even worse. When it comes to these locations, masks need to be removed during eating and drinking, and patrons are at high risk of inhaling infectious aerosol clouds. Visiting a gym or church was associated with a modest but statistically significant increase in risk of 1.6 times, as shown in this figure. Points to the right of the line indicate increased risk, points to the left of the line decreased risk. The brackets indicate the error bars a range of potential variation. As you can see, for churches and gyms, those error bars vary widely, extending below 1, making conclusions about these spaces less definitive. These studies were completed before the appearance of Delta or Omicron variants, and it is likely the risks associated with these closed spaces are now considerably higher. In the early phase of the epidemic, in both China and Italy, a large portion of hospital-acquired or nosocomial transmissions occurred through contacts between clinicians and visitors with no or mild symptoms of COVID-19. A number of healthcare professionals also contracted the virus in New York City in this way. In addition to doctors and nurses, support staff who were not provided with adequate PPE became ill. Healthcare professionals must beware. With the spread of Omicron, the risk of nosocomial infection is even higher. When it comes to who is infected, this virus is an equal opportunity promoter. Nearly everyone appears to be equally susceptible. Serologic studies suggest that children are more likely to have been infected as compared to adults. 75% of children aged 0 to 17 were seropositive for SARS-CoV-2 in February of 2022 versus 33 to 64% in adults. Males and females are infected with nearly the same frequency. However, males and older adults tend to develop more severe disease. But more about this in videos on clinical manifestations. Our understanding of how the virus infects humans described in the first video on pathogenesis is supported by studies of viral counts in the nasopharynx and throat over time. Soon after being infected, 1 to 2 days before onset of symptoms, as well as during the first 3 to 4 days of symptoms, the counts are very high, 10 to the 9th to 10 to the 12th, and these patients are most infectious at that period. Most disturbing, the Delta variant can infect 1 in 8 individuals who are fully vaccinated, and when it comes to Omicron variant, 70% of those who have had 2 vaccine doses are susceptible to infection. The viral counts in the nasopharynx are comparable to those of unvaccinated individuals. However, the duration of carriage tends to be shorter. The good news is that vaccination continues to protect against severe disease and death, but more about this in Module 3. Some individuals said the virus RNA for many weeks. However, live virus has not been cultured beyond 9 days after the onset of symptoms. To summarize the content of this video, transmission is predominantly by droplets and aerosol. Contaminated surfaces are likely to play a minor role. Beware of the asymptomatic superspreader. Rapid spread from person to person occurs predominantly in families and less commonly is spread in large gatherings, cruise ships, closed public spaces, including restaurants, coffee houses, and bars, with a reproductive rate of 2 to 2.5 or 2.7 for wild-type virus, 3 to 5.0 for alpha mutant, 5 to 8 for the Delta variant, and 10 to 16 Omicron variant. 10 to 20% of those infected are primarily responsible for spreading the infection to others, on average each infecting 10 to 80 individuals. This is why larger indoor gatherings should be avoided. If there is a super spread in the room, a large outbreak is likely. Individuals appear to be almost equally susceptible to infection, with the possibility that children may have a higher infection rate. Individuals are infected for 2 days before and 3 to 4 days after the onset of symptoms, and their secretions can contain very high concentrations of virus, billions to trillions of viral particles per milliliter.